Welcome back to the award-winning Hometown Health. Good things for those who wait. I'm Mark Roberts.
And I'm Beverly Onstead. Diet plays an important role in the diagnosis and treatment of celiac sprue disease. September 13th marks National Celiac Disease Awareness Day, a disease that's triggered by consumption of the protein called gluten, which is found in wheat, barley, and rye. It takes an average of 11 years for patients to be properly diagnosed with celiacs, even though a simple blood test exists. Celiac disease affects more people in the United States than Crohn's disease, cystic fibrosis, multiple sclerosis, and Parkinson's disease combined. 1 out of every 133 Americans, about 3 million people, have CD. There are currently no prescription medications available to treat CD. The specialist at Advanced Gastroenterology explains celiac disease and how it's treated.
Celiac sprue disease is actually an autoimmune condition where the body, essentially in layman term, causes antibodies that will not allow the GI or the small bowel to absorb wheat products. Now, if you go into your cabinet, food pantry, and you look on the box, wheat is very prevalent. It's used in binding agent, it's used in many things that we eat, and people are not suspecting that. Now, the reason why celiac sprue disease is becoming more commonly known is because of the awareness in diagnosing the condition.
A lot of patients mention that they see this when they go to restaurants or in the supermarket. Celiac disease is actually very common. It's supposed to be, it's 1 in 100 people. Like many other areas of disease processes, some patients may have it very mild, some may have it very extensively. So it's a very common condition. It's a gluten-sensitive enteropathy where people have sort of allergies to gluten products like rye, wheat, and barley. So pastas, rice, a lot of carbohydrate foods have gluten, and the patients develop this autoimmune reaction to these products, and it develops, they develop what's called a malabsorption or sloughing of the small intestinal mucosa specifically, so that they don't absorb or digest properly. And patients can come in with significant symptoms of severe weight loss, abdominal pain, bloating. And some patients may be very mild, may just have a little bloating, a little bit of loose bowel movement. So any patient that we actually see with diarrheal symptoms of bloating, they should be checked for celiac disease, because it's easily treatable. The treatment is just diet. We now realize that some patients may have what's called gluten sensitivity, meaning that they don't actually get the disease with the malabsorptive problems, but they may get some mild symptoms, a little bit of bloating, a little bit of loose bowel movements when they use products high in gluten. So those patients actually, without the celiac disease panel becoming normal, but just using a gluten-free diet, they actually feel better. So it really is a healthy lifestyle.
As you can see, celiac disease is a very common problem that often goes undiagnosed. If you'd like to find out more about the testing and treatment options offered at Advanced Gastroenterology, please click the Celiac Awareness Story link icon on our homepage, yourhometownhealth.com.